and then as I did my course and I started learning more and more about how abdominals work and the pelvic floor and how the pelvic floor and the diaphragm work together, that I was like, wow, this is like way far reaching, you know. And then as you started to introduce like internal talk and stuff, and then you're talking about deep abdominals, and that really relates really well into sort of like a lot of what I've learned as well. And I started to be like, this is actually huge, actually. And I think this is a missing piece in a puzzle for so many people. So, you know, for a lot of women, pregnancy is the straw that breaks the camel's back with these things, with these issues. This is where they're going to come to the surface because you put so much pressure on that system in that short space of time. And then you go through a very traumatic event, which is childbirth, whether it's a cesarean or a vaginal delivery, you go through that. And if you've been managing that system poorly for however many years before, then you are not going to fare well when you go through that massive trauma. It's just like if you didn't move a bicep well, you know, and then you tore it, and then you were trying to rehab that but still moving it poorly, you're going to struggle to rehab it. Whereas the person who moves it really well and then they do, you know, go through a trauma for whatever reason, theirs is obviously going to rehab better because they're moving it well. And it's the same for your core and your pelvic floor and pregnancy and all these things. That is the trauma, but sometimes there's some of these underlying things that actually you could be doing better, that would like change not only the way you move and feel, but like your long-term health.